Hey, good day, everyone. My name is Dr. Gerald Morris, and today I am going to be talking about a new and exciting treatment we have here at AMG called Stemwave. This is for regenerative joint treatment to help those with chronic pain, stiffness, and overall achiness. So, what you will learn in today's quick, brief webinar is what it is, how it benefits you, and how you can begin to transform your life and begin to move further and further away from chronic pain. Let's get started. So, let's talk about these five individuals here. Okay. First, we'll talk about Tom, 68 years old, retired, loves woodworking. But what he's noticed is that his wrist pain has been getting worse since he began to dive deeper into his hobby, and it's making his life difficult. He's on oral pain medications and still not getting bang for buck. Then we go and let's look at my friend Scott here. Loves tennis. And now he's having more and more pain of tennis elbow for the last few months, and despite his best efforts, not getting any better. He loves playing rounds with his wife as they are quite an active couple. Next up is my buddy Jim. Enjoys golf with his buddies, but an old college shoulder injury is slowly rearing its ugly head again. And this is making his life difficult. He's making his tee times not worth it, and he's began to kind of move step away from the game, which he loves so much. Then we go to dear old Mary. Since she retired, she's gone into Zumba, trying to get healthy with the girls, but an old knee injury has been plaguing her for the last 2 years and it's getting worse. She's tried steroid injections, she's tried over the counter pain meds, and she really wants to avoid surgery as she knows that can definitely hamper her continuing with the Zumba that she loves. And lastly, we're looking at Jennifer and John here. Love the outdoors. Her knee pain is now beginning to become a real problem for their hiking trips, which they do. They're an outdoors couple and they love spending time in nature. But as you can see, her knee pain is really getting in the way of her enjoying her life. Now, how many of you here can identify with at least one of these particular individuals? I know I can because I do have knee issues myself. So this is why I dove deep and did my own research to figure out there must be something we can do to help patients who are suffering with chronic joint pain live a better and fuller life without giving them a whole bunch of downtime or more medications or anything of that sort. And this is where Stemwave came into play. There they are again. So the goal of Stemwave, let's talk about that now. So it's basically to give you back your life, to be able to allow patients or clients to be able to get better sleep, improve joint mobility, and step away from being frustrated with just the rigors of dealing with chronic joint pain, despite your best efforts to avoid them. So that begs the question, how do we help get from where you are today, which is obviously living with chronic pain, living with chronic stiffness, living with decreased mobility, to a point where you can wake up in the morning or you can be able to travel and do the simple things that you have lost love for in life. Let's look at the root cause of where joint issues come from. It's inflammation. Inflammation is everywhere. It's all the chronic illnesses that we treat as physicians. We know that its base is built on inflammation. You get pain that seems to be never ending just because of that chronic fire that's happening in your joint. Stiffness, which can happen for many reasons. Scar tissue as well as swelling in that particular joint makes mobility a lot more difficult. And like I said, swelling before, swelling kind of goes up and this kind of completes and restarts the cycle of pain. So this is a revolving door of what's happening in your joints at this moment for those of us who are suffering with chronic pain of some sort. Now, Stemwave was designed to address each of these, and it does it expertly. Main thing, knocking down that inflammation. So how does it work? Stemwave, right? It sounds like wave, sounds water. That is true. So this particular technology is harmless but useful shock waves. Now, okay, hold up. When we say shock waves, we don't necessarily mean you're getting shocked because you're not. It's actually the sound that's emitted in the transducer you see there creates a wave of energy that we then use to help treat the joint of that's causing you the issue or hampering your overall quality of life. So here's some of the short-term benefits, as I mentioned before: reducing inflammation, reducing pain, and improving range of motion or mobility. And it is true, I would say Patients typically notice 20-30% improvement after their first treatment with us. And that is something that even amazes me to this day when I treat patients with the stem wave in our practice. It's funny, you do this enough times and you think you get used to it, but just hearing someone say, oh my gosh, that feels so much better, it just brings joy, you know? Now, if we look at more of the long term benefits, because let's face it, we want the short term, but we live in the long term. You get all of the short term benefits that I mentioned, right? Plus, you have increased blood flow, which leads to release of growth factors. The tissues begin to regenerate in there because of the shock waves hitting those cells. Increased collagen synthesis, which is important. And any scar tissue you may have, we help to break that up and allow the body to rebuild even better. So let's compare stem wave to other modalities that we have, or I currently use in my practice of medications. Now, they are a good adjunct and they do help a lot of patients, but they're not the buy all end all. Like NSAIDs, Tylenol, even the chronic opioids, which we know are not, most physicians like myself are not a fan of. But even those medications, the opioids, do not touch the root cause of your pain, which is likely inflammation. Injection therapy. So I do utilize corticosteroids in the form of Kenalog in the actual joints, which can help take the edge off. But here's the trick though. Yes, the pain may go away, but we did nothing for the long term inflammation. We made you feel better, but we did not do any healing. And study after study shows that long term use of steroid injections in joints is not good for the joint in the long term because you get more degradation of bone, you get thinning of soft tissue, and overall, down the line, you are still looking down the barrel of the gun of worsening joint issues. And of course, the end stage of most patients' joint lives can end up being surgery. Whether it's a meniscal issue, if it's your knee, or rotator cuff in the shoulder, or even spinal surgery in the back. And we do prosthetic replacements using total hips and total knees. And that is something that with the stem wave, we are trying to help reduce your risk of having. Because let's face it, it's better to keep the joints you have and love the joints you have and get your body feeling much better. Now let's look back at the benefits again. So that way, for those of you who missed it, so you can get it. Non-invasive. There's no drugs involved with stem wave. Natural healing of the body. I think that's the biggest one people need to focus on. Accelerates your own healing. Reduction in inflammation. Think of inflammation as that forest fire burning in that joint for months. And for some of us, even years or even decades. We're trying to put that to bed. Okay? Improving range of motion. Where patients can probably get their arm up to here, now they're going all the way up as we treat them. There are no negative side effects of this particular treatment. I haven't seen any in the literature, neither have I experienced any with my own clients I treat. And what I love is no recovery time. Basically, you can do your treatment, and right after we're done, you take off and go enjoy life. And for the vast majority, I would say if not all, after that treatment, they feel a little bit better, enough to go out and be like, okay, this is weird. So all these are benefits of the actual treatment. Now, when you come in, here's what to expect, right? This is called a discovery visit or mapping visit, as we call it, right? You come in, you and I sit down, we talk, we figure out what's your why, what's this joint preventing you from doing? Because I could spit out science to you all day long. It doesn't matter to you unless I can show you how we can help you live better. And this is what we do. After I examine you, my team and I look at the documents you may have brought in, whether it's imaging, we do the mapping or discovery session. We treat you in that particular session, right? And as you can see here, that's the transducer, and you're going to get a short clip of me treating someone in a while and seeing what it is. The sessions only last 8 to 15 minutes. I mean, that first consult with me is going to be longer because I want to get to know you. I want to know what it is I can help you with achieving with regards to your joint pain, whichever one we're taking care of at that time. But once you get going, and you will, each session takes about anywhere from 8 to 15 minutes. You pop in, we treat, we let you go and live your life. Now here's a quickie of what it looks like when I'm treating someone. Okay, good. Right? And you can hear that sound that you're hearing, the tapping. That is actually the sound waves being emitted from the transducer into the joint, activating the healing, increasing the blood flow, reducing the inflammation, all those great short-term benefits, and building on the long-term ones that you will definitely experience once you get your treatment going. Now, this is actually a testimony of one of my clients, early adopters of this particular treatment, and you can hear her give her side as to what she experienced. Happy Friday, everyone. Today we have our lovely patient here, Cheryl. She's been with me for a while. We were discussing, and she actually has graciously given us a video testimonial today about her experience so far with our handy dandy Stemwave for joints. So, Cheryl, tell me how's it been so far? You're on what session now?
Today was number 4.
Number 4, okay.
Right, and it's amazing because I always thought, a certain amount of pain and discomfort was part of aging, and then I'd have to put up with it, and then I only had options that were either injections or pain or surgery. And those were just not viable for me. So when you told me about this, I thought, okay, because things that usually never work for me. I'm the type of person where I'm always the exception. And I was amazed. After the first session, I had a problem with my knee swelling, walking my dog up and down hills, because we do a lot of walking. And after one session, it was amazing. The swelling went down, the pain around my knee cap was just almost diminished.
Nice.
And I also had my shoulder done because I have osteoarthritis.
As I know, yes I do.
And I had very limited range of motion to raise my elbow above my shoulder level and to reach across. And I had to sleep on my opposite side. So now it's, I have better range of motion. If I roll over, I don't wake up with pain.
Pain, yes.
And I just can't believe it. It's just so incredible that the body's actually healing itself.
And that's the beauty of the Stemwave. I mean, it literally is waking up your body's healing potential, getting you to be able to live a fuller life, like you said, to walk puppy up and down the hill without worry, to roll over in bed. It's the small things people don't realize that they are suffering with, that they don't have to.
Right, and you just think it's a part of life, a part of aging, and you really don't have to put up with it.
It's not. So thank you so much, Cheryl. We have a few more sessions to go because it's not a one and done. We're just going to keep building on this.
But I can feel it progressively getting better, and I'm so thrilled with it.
Thank you so much for your time, Cheryl. Let's keep you going, keep you strong, keep you healthy.
Thank you very much for this.
Oh, no worries. Thank you guys for spending time with me today, learning about Stemwave and what we do here at AMG. And I wanted to take the time to show you our social handles. There's our Facebook, our Instagram, and our TikTok. We do a lot of content on there with regards to health and wellness and overall getting fit and getting healthy. So reach out, talk to us, give us a call or text, find out more about what we do. And if you are interested in getting a discovery session or mapping session with me for the Stemwave, definitely reach out. We'll be happy to help you live life better with our help here at AMG. Thank you.